been diagnosed with Crohn's disease over 20 years. My Crohn's disease in 60 seconds or less. I have a permanent ileostomy. I've had this for 6 years now. My sole source of nutrition is TPN, so I get my IV nutrition through my port every night. I am awaiting actually a intestinal transplant at DC, or at Georgetown in DC, because I have had 3 major resectionings. I only have 3 feet of bowel left, so I'm also considered to be in intestinal failure with short bowel syndrome. While my story is definitely drastic, it's not necessarily uncommon. A lot of people outside the patient community don't realize how devastating this disease can be when the symptoms aren't controlled very well by medication or lifestyle changes.
Crohn's disease is an inflammatory bowel disease that causes inflammation of your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. The inflammation caused by Crohn's disease often spreads deep into the layers of affected bowel tissue. Laboratory blood tests may be taken to show elevated white blood cell counts, meaning infection or inflammation, and then colonoscopies are done to allow for biopsies to be taken and sent for examination to confirm the diagnosis of Crohn's disease. One part of your immune system is a protein called tumor necrosis factor, shown in purple, also known as TNF, which is produced naturally by the body's immune system. Crohn's disease has been linked to an overproduction of certain proteins. One of these is TNF. Humira, shown in rainbow, is a medication called the TNF blocker. It works by binding to TNF molecules and blocking them. This helps reduce the inflammation that can lead to symptoms of Crohn's disease. TNF is an immunity-modulating cytokine required for immune processes. The function of TNF-alpha requires smooth interactions with its 2 receptors, TNF receptor 1 and 2. Blocking the interaction between TNF-alpha and TNF receptors has successfully been developed as a therapy in treating inflammatory or autoimmune diseases. Adalimumab, which is Humira, is an immunoglobulin antibody composed of a light chain and a heavy chain that participate in the interaction with TNF-alpha. All of the contacts come from complementarity determining regions known as CDRs. CDRs L2 and H2 contribute to the majority of the interactions with the antigen. Over 20 pairs of hydrogen bonds or salt bridges stabilize the TNF-alpha adalimumab Fab complex, which indicates a strong and stable interface within the antigen-antibody pair. Therefore, binding adalimumab to TNF-alpha can efficiently compete with binding TNF receptors to TNF-alpha. The interface between TNF-alpha and TNF receptors is blocked in the presence of a sufficient amount of adalimumab, which prevents the function of TNF-alpha in the pathological process, therefore helping relieve symptoms of Crohn's disease.